For people who are on medications, is there a potential issue for any specific medications? I get the question about benzos or other pain medications.
Yeah, very good question, very important question. There are no major specific red flag concerns because I've said this before, I formulated both products with polypharmacy and drug-herb interactions in mind, especially with respect to the main classes of drugs that are used for mental health concerns and chronic pain conditions. One thing I should say is be careful of excess sedation if somebody's on benzos. But in general, neither product is excessively sedating. People don't report that they feel really drowsy or anything when they use the topicals, even if they're not on medications. But that it's kind of always my duty to say, if you're taking sedatives, be careful if it makes you more sleepy. But there's no direct concerning interactions in terms of receptors. And you might find online, if you do use Dr. Google, that it says, oh, potential for interaction here, but a potential for an interaction or a theoretical interaction is very different than an actual true interaction that's documented. So be careful when reading that, or defer to your physician, or shoot us an email and we can look into it more specifically. But I would say the only other sort of like be aware situations are if somebody is using high doses of NSAIDs, so non-steroidal anti-inflammatory drugs like ibuprofen or something like that. Careful if you're using more than like or probably 3 or 4 full therapeutic doses of sweet relief, especially if you're using a lot of aspirin in particular, not really the other NSAIDs, because there are methyl salicylates in the menthol that we use. But again, in terms of interacting, unless you're using huge amounts of sweet relief topically and taking huge amounts of aspirin orally, which most people don't these days, it's not going to be an issue. And actually, we have found through multiple patients that most people can reduce or eliminate the need for high doses of NSAIDs orally and even Tylenol orally by using sweet relief. But when in doubt, always check with your provider, or again, shoot us an email and we can kind of help you guide or help guide that. The only other thing that could potentially have a theoretic complication is people, there is evidence that using high doses of CBD during active immunotherapy for cancer can blunt the effects of the immunotherapy because CBD is so anti-inflammatory. That said, the way we formulated it, we're not using super mega doses of CBD like people would be taking orally. And it's working better than a lot of these topicals for patients that are using mega dose topicals because of that systemic absorption. So you're still getting a therapeutic dose, but it's lower than what people would be taking orally. So it should not blunt the effects of the immunotherapy. We're talking about really high doses. So I actually have a patient actively on 2 immunotherapies right now, and she's doing fine using the sweet relief on her areas of pain. It's not a problem. It's just really in those higher oral doses that it becomes an issue. But it is my duty working in oncology to kind of have that disclaimer. And again, when in doubt, ask your physician. If they don't know, shoot us an email and we can help you kind of work through it.
Yeah, and I think the topic on NSAIDs is really interesting because, as we have discussed, and it's come in many conversations with people who are using it. If you have pain for a long period of time, you've probably been on NSAIDs for a long period of time. And being on NSAIDs for a long period of time can lead to chronic kidney disease. And one of the things that I found really exciting about the product is the product is one of the only really good pain relieving things that doesn't put you in a predisposition for chronic kidney disease. And not only does it do that, but there's an ingredient in it called alpha lipoic acid, which is kidney protective. So it's also helping to repair some of that damage, which we just love.
Which we love. Yeah, I mean, alpha lipoic acid, I've actually seen reverse chronic kidney disease in multiple situations. So it's very nephroprotective or protective of the kidneys and can actually reverse damage that's been done to the body by high doses of NSAIDs over long periods of time. So it's pretty awesome. And again, it's safe to use them side by side, and it will offset some of those toxic effects to the kidneys if somebody is on NSAIDs, and hopefully can reduce their need for the
Mhm.
NSAID so that they can at least halt the progression of the chronic kidney disease if it is due to long-term NSAID exposure.